Welcome back. Now, next up for you, we have a cracking interview that Max has done with Roberta Lipson. She will be available to ask any questions afterwards, and indeed to answer any question afterwards. She'll be very willing to hear from you. So do post any questions that you have in the chat box, and that'll be available straight after the interview.
Hello, welcome to HBI 2020. I'm here today with the extraordinary Roberta Lipson. Roberta, after graduating with business MBA from Columbia University, decided in 1979 as a very young woman that she was going to go and live in China. She then decided that she was going to set up a private hospital. She did this, and this in turn became United Family Health, the largest international hospital chain in China today. In 2018, New Frontier Group, together with Roberta, decided to buy the business from TPG for $1.4 billion. They did this and listed it on the New York Stock Exchange as New Frontier Health, where it now trades. The business today is active in seven cities, including Beijing and Shanghai, with 9 hospitals, 18 clinics, and over 700 acute care beds. Nearly 80% of the patients are Chinese, demonstrating that this is now no longer no expat play, but is really embedded in Chinese society. But enough of the history. I'm here today with Roberta to talk about the future. And we're going to talk about Roberta's buses. Why buses? A chief executive once said to me that he saw his only role in life as being to ensure that his company caught the right buses. That meant being at the right bus stop at the right time and then pushing the company onto the right bus. So, Roberta, what are your 3 buses, please?
Well, I would say as a healthcare provider, first and foremost thing that you always, every day must think about is quality and safety. So I'm going to put quality and safety on my first bus because I don't think that the other buses have any business in life without that first bus setting the road for them. I would also put quality and safety as the chassis of the other buses, but since we're only talking about one bus, one title, I'll put quality and safety as the first bus. The second bus, especially at this time, is the full digitalization, digital transformation of much of the healthcare process. So digitization is something that's been going on for a very, very long time. We've always had it as a couple of seats in our bus, but now we have a full bus dedicated to digital transformation, and it's a supercharged bus. The third bus, I would put being able to fulfill our dream of becoming the full life cycle partner of our patients. And there are many elements of that. So if you'd like, we can talk about each bus one at a time.
That sounds great. Thanks very much, Roberta. So let's look at the bus which is dearest and most important to you, which is the quality and safety bus. How do you ensure, I suppose the $150 million question is, how do you ensure quality and safety in a hospital? Because hospitals are inherently unsafe places.
Right, so the good news is that that's not only most important to me, but whether they know it or not, it's most important to every one of our clients and patients. So of course, it's absolutely every day, first and foremost in our minds. How do you ensure it? Well, it starts, I think, with the concept of the business. It starts from building the hospital as a safe place, making sure that the infrastructure is a safe infrastructure. Secondly, making sure that the policies for safety are in place. And once they're in place, every single employee, every single staff member, whether they be medical staff or ancillary staff, has to be totally trained in those policies. In addition, people need to be incentivized to carry out those policies in everything that they do. And I believe that the biggest incentive is giving people a culture in that doing the right thing for the patient, keeping the patient safe, and keeping them healthy and making them healthy is the best reward in itself. So making that reward inherent in the doing, and that you can only do through a culture. Of course, we also have financial rewards, and that works differently with different kind of staff, but I believe that nothing is more effective than making the reward inherent in the fulfillment that each staff member feels by doing the right thing. Thirdly, obviously monitoring, making sure people in fact are doing the right thing, and then giving non-punitive feedback, which allows us to improve the system, improve our policies, improve our training where the system falls down. So having that system with a total feedback loop, and at the same time having a culture which encourages the right thing, and thirdly making sure that it's a non-punitive culture which looks at system improvements and not individual faults.
So if somebody has made a mistake, I mean, the mistakes do happen, don't they? I guess. I mean, I suppose the danger is you set up, you say quality and safety is paramount to us, and somebody makes a mistake, and there's the danger always, I suppose, that if you're not careful, they will cover the mistake up. They will not report it because they know that quality and safety is very important to you. How do you avoid that situation?
Well, in fact, we reward reporting. We give prizes each month for the organization that does the most reporting and individuals that do the most reporting. And if it's a non-punitive reaction, and we realize that, well, of course, there could be someone that's just incompetent or has a flaw that we can't correct. But at first, the first thing that we'll always look at is the system. Did we do sufficient training? Did we keep that person working too long hours? Did the person skip their orientation, or was there something about our environment that caused that person to make a mistake? Of course, there are rare situations that somebody, for some reason, is not competent to do their job, in which case one deals with that. But for the most part, people don't worry about reporting because we're looking all together. How do we make our system better? How do we avoid mistakes? How do we avoid problems and issues?
Yes. And is this a different system from the system you might get in an American hospital? I mean, Chinese culture is very different, isn't it? It tends to be much more hierarchical, I believe. So do you have to create something which is different in China, and in what way is it different from what you might find in America?
I think the theory in American hospitals is the same, and having never actually worked in an American hospital, I can't say how it's carried out. But I can say that there are definitely challenges coming from Chinese culture and coming from hierarchies that we've busted through in our system. For example, we've had many years of campaigns and education, and it's ongoing, to get nurses to speak up, to get nurses to realize that they have an equal voice in a timeout or stopping a procedure that the doctor does. And in fact, even our cleaning people have that voice. So we've been drilling into people's head that everybody in the hospital not only has the right to speak up, but has the responsibility to speak up. And that didn't come naturally. In fact, I think in the traditional Chinese system, if your professor was the one doing the surgery and you were the second surgeon, you did not speak up. It would take huge, unnaturally huge courage to speak up about something that your professor was about to do. Or if, for example, you just read evidence-based reason why they should not do what they're about to do. It really doesn't come naturally. So it was very difficult at the beginning, and I think part of the way we were able to do it is that when we first started building this system and this culture, we had quite a large complement of foreign doctors from the US and from Europe, as well as nurse trainers, as well as nurses that had experience outside of China and got to witness that kind of a system. So the benefit of having critical mass of people that have seen and experienced those kinds of systems here, instilling it, and then making sure that we were true to our ideals and true to the theory, and in fact did not immediately seek to punish people for things that went wrong, but rather looked internally at our system to see how we could improve and make sure and insulate future errors of the same kind.
Okay, fine. Thank you very much. That's fascinating. And of course, the same issues actually occur quite regularly in Europe and America, don't they? People not wanting to criticise a senior doctor. This has happened in the NHS in the UK, for example. So why don't we go and look at your next bus, Roberta? What's on the next bus, please? It is digital transformation. So what do you mean by that?
Okay. So from the earliest days, we began to develop our EMR, our appointment system, and slowly but surely we added in our PACS system and our list system and our risk system, and we ended up with an amalgamation like many hospitals get, along with their enterprise management system, CRM system, etc. And over the last few years, we've been tying these systems together to have more and more of a unified platform for business analysis, for patient care, for prescribing, for etc. and so forth. And we've made quite a bit of progress in doing so. At the same time, we began a few years ago working on, in China, the smartphone is king, and we do almost everything on smartphone. So we started a project of building a patient portal which links our patient more intimately with our internal systems. So over the last few years, it became possible for our patients to make an appointment on their patient portal, to check their medical records, to see their lab results, to see their vaccination records, to check what sort of doctor would be appropriate for what sort of issues, etc., and so forth. We made quite a bit of progress in this, but the onset of COVID showed to us that patients were increasingly willing to seek services and seek care online or on their smartphone. At the same time, the Chinese government realized the potential contribution especially during a pandemic time, that could be made by moving certain services online. So a bunch of new legislation came into effect, which made it possible for hospitals like us to be licensed as internet hospitals. And all kinds of policies came into effect to help ensure the safety of patient data as it became more and more in the cloud and online, and the interfaces with the healthcare systems became proliferated. So both having this policy infrastructure and a clear message from consumers that they were more and more willing to engage with us online. So we're in the process of what we started early in the COVID outbreak to work on online consultations that through our portal, our patient portal, or through certain other platforms, patients could make appointments to have consultations online. We found the uptake to be very impressive. We found patients very happy, especially in the height of the COVID outbreak, to take as much advice online until our doctors told them they had to come into the system. So physically come into the hospital. So we started running with that. As I said, the bus has become turbocharged, and we're working on absolute seamlessness between our online and offline platforms. In China, there are quite a few online platforms that engage with many more patients than we do in a much more
Yes.
kind of wholesale, short consultations kind of way, mostly ending up in providing a prescription. And that prescription, the drug is sold from their platform. That's very different from our online platform, where our members and our existing patients can interact with their doctors in between visits. And then we also do have new patients coming into the system through the platform, but in no case is our aim, either in our brick and mortar facilities or online, to sell something. And so I think this combination of having continuity of care, online, offline, pre-hospital, pre-in-person consultation, post-in-person consultation, has not only improved the patient experience for our traditional existing patients, but has also brought a whole new segment of people who find it less threatening to engage with us first in an online consultation than they might feel walking into a very high-end international hospital. And it's an interesting and easy entry point for people outside of our traditional catchment.
So if I'm Chinese and I have a problem and I know of your reputation, I can book in an initial consultation, and I have to pay a certain amount of money to have an initial consultation with a doctor on a telehealth platform before and getting the response, and then I can then decide where I'm going to take that afterwards. Is that right?
Right. So for initial consultations, according to the Chinese rule and policies, we're allowed to give general information, general consultations, and maybe some ideas of where that patient should go next to explore their problem. We are not allowed to give first-time diagnosis online. Um, we can, for chronic conditions that have already been diagnosed, we are allowed to give advice and specific, we can prescribe, we can give advice. But for the first time in, yes, the patient can meet our doctors, can get general advice, they can talk about their problem, the doctor can give general information about the issue, and then say, you may want to, if that's necessary, next step, or you may not need to worry about this, or you may want to consider coming to either your local provider or coming into a United Family hospital for further consultation. Once they become a registered existing patient, they can continue to have online regular visits when that's more appropriate than an in-person visit.
So it's quite an important recruitment funnel, really. I mean, obviously got the potential to be a place where you build very rapidly a certain level of trust between a patient and a particular doctor and your group.
Exactly. So it's both become a platform that can broaden our reach to a different patient population segment and give them an easy entry point to the system, as well as greatly improving the patient experience for our existing patients.
Okay. So have you had any feedback at all from, I mean, what a patient, I mean, I'm hearing around the world that patients really like doing telehealth, and I mean, presumably you're monitoring patient satisfaction. Have you got any scores or any kind of quantitative feedback on this?
The level of appreciation is tremendous. And we've taken a look at, people that have accessed this online system more than once, and the numbers are very high, 70, 80%. Once they've done it once, we'll do it again. And for existing patients, it's not a cannibalization of in-person contact. It's a supplement. And so people who have accessed online services do tend within a matter of weeks or months also to come in for follow-up or for procedures. And quite a high number of first-time people that are accessing our system for the first time online are also following up with an eventual visit to the hospital or the clinic.
Good. So I'm aware of the time, so I think we need to move on to your third bust, which in many ways is by far the most complex, isn't it? Which is looking at full life cycle partner. You want to be the full life cycle partner for your patients. So presumably, I mean, in historically, you go into hospital for a procedure, and then you leave that hospital, and you may well never go back to that hospital. There may not be any follow-up. So historically, I guess hospitals often have a very light patient touch, and I guess that's a bit problematic, isn't it, if you want to build a long-term relationship with a patient?
So when we started looking at what were the reasons that we were in this business and what was our goal in this business vis-a-vis our customer base, and when we started looking at why do people go into healthcare at all, why do doctors become doctors, why do nurses become nurses, and I think the answer in all cases is not because we want people to get sick and come and access our services, but rather we hope the world will be a healthier place and people can live healthier, happier lives. And as a healthcare provider, the way I believe to make that happen is to make sure that people are getting the preventative care they need to be able to live a healthier life. So if you're a fee-for-service hospital system, those goals are a little bit at odds with your bottom line, a little bit at odds with maybe what your investors' desires are. So for me to look at an approach that will reward us for keeping patients healthy, both in terms of monetary rewards in the short term, making sure that we get paid for preventative care, as well as the long-term reward of having a very happy that wants to keep paying you for keeping them healthy. So we, a few years ago, um, yeah, and just to back up a bit, we started our life as a primary care provider, along with being a very boutique maternity hospital. And it turns out when you do a really great job of giving women a safe and amazingly happy experience in childbirth, they really trust you and really appreciate you. And this meant that Chinese people who were um, used to their entitlement of going to a public hospital for free decided to pay for this childbirth experience. And they had such a great experience, they decided to pay for their kids' pediatrics care. As these women grew older, they started having premenopausal problems and their own health issues, and then they stayed loyal to us. As their husbands went into middle age and were having fatty livers or maybe heart problems, they brought their husbands in. Eventually, they brought their parents in as their parents started aging. So now we take care of many generations of a family. So this full life cycle care issue meant that we had to, and we had the opportunity to care for people in different stages of life, including hospice care now. And it meant that we needed to make sure that we could provide those services through different phases of life, without forgetting that we started out as a primary care provider. So we had this really strong infrastructure of family doctors, and both in the hospitals and in the clinics. And we wanted to be true to our original motive of keeping people healthy through the life cycle. So we, a couple of years ago, began partnering with insurance companies to share the risk, where we would get paid part of the premium upfront for giving people a yearly checkup and making sure that we were doing early interventions when necessary, making sure people were vaccinated, making sure they had their screenings when they needed to have their screenings. And so that was a fixed amount of money that we got. If we did that job really well, if we do that job well, we split what's left in the premium with the insurance company. So we make a guaranteed amount of money for the preventative care. We keep people well. We make money for doing that in the risk pool. We're happy, the insurance company's happy, and the patient's happy. It's like a beautiful formula. So if the patient gets sick, either because they weren't lucky or we did a bad job, then it's our job to make a treatment plan and return them to good health. We get paid still on a fee-for-service basis for doing that. If we do it efficiently, there's still money left in the risk pool, and we still split that money. And everybody's happy also because the patient got better, and we did things efficiently, and we still made a profit. So we're halfway there. So we're doing part of the risk sharing and having incentive to keep the patients healthy. And yeah, and eventually we will take on more and more of the risk as we get more experienced at it. But I think that this is the holy grail of healthcare. If we can find ways to build our business, stay in business, while keeping people healthy and efficiently returning them to health, and our financial model matches that.
So how I mean, because it's funny because insurers are always telling me how much they want to do value health and how much they value it and all the rest of it, and then when you probe a bit more deeply, you find that most big private medical insurers don't really measure quality. in a systematic, holistic, across the system way, and they don't fundamentally care. And when you talk to a lot of hospital groups who've done a lot of work in value health, you find people who say, well, we spent millions and millions of dollars on value health, and we show the insurers the results, which demonstrate that we're the best place for them to send their patients. And they're not interested. They ignore it because people want to go, they want their patients to go where their customers want to go. So it seems to me to be often a disconnect between the rhetoric that is talked by big insurers, and I'm thinking here people like Aetna, Cigna, Bupa, and AXA, and the reality on the ground as experienced by reform-minded hospital groups. I don't know if you agree with that, and I also was wondering to what extent this interaction with insurers, is this happening with big international insurers, or is it happening also with Chinese insurers? And to what extent is it happening? If you look at your customer population, how many of them are being covered by insurers like this, please?
Yeah, so I think the trick is to make sure that the service you're offering is in fact the service the patient wants, and that their experience is the best. So that is the place they want to go. And then you have the pull-through demand. So if the insurer wants to sell a policy that the patient is saying, I better be covered at United Family or I'm not buying this policy. So it's a matter of developing pull-through demand and making sure your patients are so satisfied that they don't want to buy a policy that doesn't cover care at the place that you're providing it. So I think that's the first thing to say. The second thing to say is our first partner in this program has been a Chinese insurer. In fact, it was one of our early investors, the Fosun Group. Fosun has an insurance company, and we're our first partner. But more recently, many of the larger insurance companies have expressed interest and desire to partner with us in a larger way in this business model.
Right. Okay. So, and I mean, do you have, so to what extent do patients, I mean, is your customer base mainly paying fee for service for interventions on a cash basis, or is it mainly insured cover?
Right. So among our foreign patients, which are now about 22% of our patient base, probably about 80 or 90% of them are using insurance coverage of one form or another. And among our Chinese patients, which are now 78% of our patient base, especially during COVID, we've seen the Chinese segment rise very, very, very quickly. And because so many expats were caught outside of China, our expat patient base has slightly shrunken over the last year. Now the Chinese policy has, in the end of September, they sort of loosened up and started letting foreigners back into the country. And so we expect to see that situation improve, and our expats will come back. But the expat segment is not growing as fast as the Chinese segment, where more and more people are affluent enough to consider the private healthcare option. So of those covered, so the Chinese population is covered to a much less extent. About a third of them, about a third of our revenues are covered by insurance for the Chinese population. And among all of those insured folks, probably 5% are on that kind of, on our shared risk program. But what we have been able to show, and I'm super proud of it, and I'm sure eventually get the big insurance companies to realize this is amazing, that when we've been looking at the groups that we've been with chronic diseases who are in this program, those with hypertension, hyperlipidemia, and other chronic high lipid and other high, diabetics, they have gotten so much better by being under this program and having our care managers looking after them in a proactive way, and having our family medicine doctors caring not only when they get into crisis, but on an ongoing health maintenance way.
Right. Have you got any? Don't worry about the clock. If you can see it. I mean, if you're looking at the chronic disease side of things, then what are the results? I mean, you say they're much better. In what way are they better as a result of this approach?
Well, their numbers have gotten better. Those chronic processes have been put under control. And if you want, I can certainly send you the numbers that have come out. But in general, it's very clear that if you help somebody take care of their chronic, it gets better. Yeah.
Okay, fine. So I guess, I mean, I think when we started this conversation, when we were talking before, we talked about HMOs and the idea that you might, therefore, at one level, become an integrated payer provider, which I suppose you are if you're getting lots of cash. I mean, if your people are paying you, well, are you? No, you're not really. So how would you move towards something more like an integrated payer provider model, please?
Yes, I think it's an incremental situation where we're taking on part of the risk, but not all of the risk. So we're taking on all of the outpatient risk, right? For the portion of premium that we get, we are obligated to do preventative care, vaccines, screening,
Yes.
checkup, and chronic disease management. There is a portion that we're still taking fee for service, but we're incentivized to do that in an efficient way.
Yes.
So it's a matter of just taking more of the risk piece on, and I believe over time we will.
And can you, I mean, finally, can you do, I mean, if you're a private individual and you want a subscription service, so you'd want to subscribe presumably to that level of all the health checks, and you could probably pay for a subscription to that, and then get a discount on any activity, any fee for service stuff you want afterwards. So in other words, you can work directly, can you not, with the private individual who wants that service without having to go through an insurer, possibly.
We also have programs like that. So we have packages that include children from 0 to 2, or chronic disease management, vaccination packages, and yes, we do. And yes, the answer is yes, we can do that. It's not quite as comprehensive as the program that I described.
Fine. Okay. Well, I guess to finish, I mean, obviously, none of your free buses had on it expansion into tier 2 cities or any of that kind of stuff. I mean, do you want to expand dramatically beyond where you are today, or not? Perhaps we could end on that note.
That's the easy part. We've been opening a hospital a year for the last few years. We have one that will open first quarter next year in Beijing, our Women and Children's Hospital. Most of our hospitals are general hospitals. We have a rehab hospital. This is our first specialty women and children's hospital, which is opening in another part of Beijing. And we have a large tertiary general hospital we're opening in the city of Shenzhen. That will be in the 3rd or 4th quarter of next year. And that's will be as large as our largest hospital. And it's our first hospital in Shenzhen, which has just been gotten to the #1 of the most affluent city in China. So we're looking forward to that. No question about it, there are plenty of cities left on the most affluent list in the top 10 that we're not in yet. We are in all of the major first-tier cities, and we believe that eventually there are probably another 20 second-tier cities that have the demand for United Family Healthcare. So we will definitely continue not only to expand cities, but also in the cities we're located in, expand our outpatient clinic network to make that kind of full life cycle care more convenient for patients. So not only will we have our clinic network, our acute care network, our rehab facility, as well as this pre and post online services for our patients.
Okay, fine. Well, Roberta, thank you very much for talking us through your buses, and we look forward to seeing how they develop. And thank you very much for your time today. Thank you.
Great. Looking forward to seeing you at your next in-person meeting.
Thank you. Well, yes, thank you. You came last time, and thank you very much. It'd be lovely to see you in London. Okay, thank you.
Bye-bye now.
Bye.
Many thanks, Max and Roberta. So we have a break now. We will see you again 1 o'clock London time for our first hospital sessions. We do hope you enjoy us then.